start our summit today from Kevin Perez, who is a co-founder of a company called Epiterna. And those of you who know the industry will be surprised to hear that is a spin-off from Ocampo Lab. And Ocampo is a big name in our industry. It is one of the people behind partial reprogramming, very fascinating technology which holds a lot of promise. Kevin was working in Ocampo Lab. He was also working at Buck Institute of Agents, so a long-term agent advocate and scientist. And yeah, today we will learn about what Epiterna does and what we have in future for us and for our pets. Please welcome Kevin.
Thank you, Alexei, for the nice introduction. So yeah, I'm very happy to be here in this session on radical longevity at Zelar.City, very nice location, and I hope you will enjoy the talk. So my name is Kevin Perez. I'm co-founder and head of research at Epiterna. So Epiterna is a longevity biotech company, and I'm going to first give you a few pointers on our company. So it's a Swiss biotech company. We're based in Lausanne in Switzerland. What we do is we develop drugs capable of extending healthy lifespan for pets and people. And as Alexei just said, the company was founded in July 2022 by Alejandro Ocampo and myself. As Alexei said, yeah, Alejandro is a very, pioneer in the field, and he developed work on epigenetic reprogramming and partial reprogramming that, started Altos Labs, for example. But this work actually in the company has nothing to do with epigenetic reprogramming. So I just want to say this. And so the company was founded in 2022. We raised we were lucky to raise 5 million from Prima Materia, which is a European investment fund created by Daniel Ek, who's the founder of Spotify. And we have operations in Switzerland and in Spain for reasons that I will talk about in a moment. So what we built at Epiterna is basically a high throughput screening platform for lifespan extending drugs. So we took all the different animal models in the field. So basically people in the aging field for years have been using C. elegans, worms, Drosophila, which is flies. They've been using more recently a fish called killifish, which lives a bit shorter than most fish. And also mice, obviously. So what we did in the company is we took all these animal models, and we tried to kind of reinvent the way we do lifespan experiments with these models. So, and the principle is fairly simple. So for each model, we take drugs and we give them to the animal in their food, and we see if the drug extends lifespan. So it's a very basic principle, but all of these models are different. They have different lifespans. So for example, worms live only 3 weeks, and mice live 3 years. So you can imagine that the logistics for doing lifespan with these animals is very different. And you can also have different throughputs. So you can test a lot more drugs in worms, for example, than in mice, different costs. And also one of the goals was to show if there are some drugs that could have a conserved effect across all animal models. So you can think that if a drug can extend lifespan of each animal model significantly, then it will have more chance to work in human. So now I'm going to show you some examples about the high throughput screening platform that we've built. So first, I'll start with C. elegans. So the way C. elegans experiments work is you have basically some worms that are here. These are the worms in a well. And sometimes the well has a drug and sometimes have nothing called a control. So here is, for example, a control well versus a treated well. And the goal is to see if the treated well, in the treated well, the worms will live longer. So I'm going to show you a quick video. So yeah, what we've built is a system that uses machine learning to basically detect when the worms are alive or dead, and that allowed us to increase a lot the throughput of our experiment. So I'm going to play it again, but basically in the control well, you see that the worms die quicker, and in the treated well, you see that they take a bit longer to die, sorry. And yeah, with this system, we can test hundreds of drugs in worms. We build the same system in flies. So it's the same idea. So these are basically vials that contain flies. And with the machine learning and the imaging system, you can tell basically automatically when the flies die. And that helps with also doing high throughput screening of drugs for lifespan in flies. And again, you can see on the left, for example, that the flies die quicker in the control group than in the treated group, and that's an example of a drug that here extends lifespan of flies. Now, as I mentioned, we also work with bigger animal models, so fish and mice. Mice, we work with conventional mice, C57 or HED3, but in fish, we work with a particular kind of fish called the killifish, which basically is nice because it lives shorter than the normal fish and you can do experiments quicker. And in these models, we didn't innovate that much. We do experiments in the conventional way. So this is a fish rack, this is a mouse rack, and we just give the drugs in the food that is given to the animal, and then we check which, if with the drug they live longer. But where our differences for those animals is the cost. So because we run all of our animal experiments in Spain, we have been able to decrease the cost quite a lot. And now basically we can run lifespan experiments in mice for a very cheap price that I will tell you in a second. And in mice, we can also monitor activity throughout lifespan. So with a technology called DVC rack, so you can see here, for example, mice with different ages, so from 6 months to 28 months. They are 24/7 activities, so this is a very nice technology. And the goal is that basically if you find a drug that extends lifespan in mice, you can also check that the mice are more active as they age, so that people call, for example, health span. So that's it. And right now, so our current screening capacity in all those 4 different models, so worms, flies, fish, and mice, is the following. So in worms, we can screen 3,000 drugs per year, in flies 600, in fish 50 drugs, and in mice 24 drugs. So also what that allows us to do is basically pre-select. So when we decide, for example, what are the drugs that we want to test this year in mice, we can pre-select them in worms, then in flies, and test only the best candidates. And in terms of comparison, so I don't know how familiar you are with this field, but there's another company called Aura Biomedical which tests drugs in worms, and we think, based on what they said, that we have more or less a similar capacity than them. In flies, there isn't too much. I mean, there's no company really doing this. I think Morten is actually talking in this session, and maybe he will show something, but as far as I know, there isn't that much for high throughput screening in flies. Then in fish, also not much. And in mice is where we have also quite a lot of competition. So the most famous initiative is the intervention testing program in the US. But we also have the initiative from Aubrey de Grey, who's also testing intervention in mice. And based on the numbers that they publicly announce, we are 9 to 15 times cheaper than them. And also for reference, right now we are testing 3 times more drugs than the ITP in the US per year. So that's more or less it for the company, for Epiterna, and I will just conclude by telling you that we have started to release some of our results in publications. So this part concerns our results with the worms. So what we did here is we basically took a lot of drugs that people were claiming extend lifespan of worms, and we tested it in-house in our high throughput screening platform. And it's interesting because not all of the drugs worked, but also, for example, here you see resveratrol that has a very significant impact on lifespan. And this one is funny because resveratrol is a very controversial drug. I don't know if you know about it, but for example, in our hand, it was one of the best drugs, at least in worms. I'm not saying resveratrol will extend lifespan of human, but I'm just saying in worms, it worked extremely well. And so we're replicating some of the results of previous people. And then we also show some nice combinations. So what you can do with worms is you can also test combination of drugs in a high throughput. And for example, here there are some examples of drugs that extend lifespan quite well in worms. And the last thing I want to talk about is a study that we published recently that is not related to the screening platforms, but in this study, so the goal was to see, okay, in the general population, we take a lot of medicines, and are some of these medicines already extending lifespan in the general population that we don't know about? So for this, we looked in the UK Biobank. So UK Biobank has followed more than 500,000 of people for more than 12 years, and basically recorded all the medication that people were taking. And the issue with this is usually when you take a medication is for a reason, and often that reason might limit your lifespan. So for example, if you take a medication for heart disease or for diabetes, the medication itself might limit your lifespan, so it's a bit tough to check if it has an effect to prolong lifespan. But you can still do that with epidemiology methods. You can adjust for confounders. And when we did that, we found that there were actually some drugs in the general population that are already extending lifespan compared to matched controls. So matched controls is people with the same health status, same diseases. And these drugs, so for example, we found, and I mean, this topic is a very also controversial topic, but we found in our study that estrogens extend lifespan in women, so hormone replacement therapy. In this study, women on hormone replacement therapy had a longer lifespan, so you can see in these graphs, basically. So it looks small, but it's very, very significant. That in blue, you know, the women taking these drugs, more or less containing estradiol, they live longer. We also found a statin that seemed to extend lifespan in the general population. And the last one was Viagra, sildenafil, that also men taking Viagra had a longer lifespan in general. And yeah, this study actually got quite some attention in the press, so you can take a look if you're interested. And that's it. I think I'm done. I hope I'm on time. Last comment, since this is a radical longevity session, I just want to say that I'm also very interested in replacement, and I'm currently also looking at opportunities in the area of replacement that I think is also very promising. That's it, and I'm happy to take questions.
Okay, how much Viagra do I take?
Yeah, I mean, we have concentrations actually. So yeah, in the UK Biobank, you can find the concentration. You can find the paper, the concentration. But I mean, Viagra is a funny one because you could say that there are also a lot of confounders
Yeah.
that we're not able to account for. You know, if they are more physically active, if they
Life
have,
is more fun.
if they have a relationship, they are happier. Exactly. So this is completely true. And so it may not be the drug itself.
Can you please show us again, like, what were the drugs on C. elegans that had the best survival curves? It was combination of doxycycline, right? With what?
Yeah, so GSK, this is a new drug actually. It's mTOR PI3 kinase inhibitor. So it's a bit like rapamycin, but it's a new drug and it works super well.
Why doxycycline? Why is the combination with doxycycline?
What do you mean why? I mean, that's what we tested because doxycycline was known to extend lifespan in C. elegans, and we found that the combination is working quite well.
And this is some Lilly's molecule, right? It's the same molecule with Lilly drug, or?
LY, I don't remember which company does it, but it's possible, yeah. It's also a PI3 kinase inhibitor. So a lot of, if you know about PI3 kinase, a lot of PI3 kinase inhibitors worked very well in our hands.
And another question. What are the limitations of your approach of basically epigenetic, not epigenetic, phenotypic screening in animals? What would be the limitation in your opinion?
Yeah, so it's an interesting question. So I think the limitation is the time for me, because, I mean, time and cost. So for example, to test a drug for lifespan in mice takes very long. If you want to do from the beginning, that's not what we do. We start the testing at 18 months, so we take old mice and we start testing. But if you want to do, for example, from the beginning, it could take 3 years to test drug. And so every 3 years you test drugs. I mean, we do it also staggered, but this is very long and very costly, so that would be one of the main limitations. And people try to use biomarkers to circumvent that limitation, but it's not completely ready. So that would be the big problem. And then the second problem is even after you found drugs that work in mice, how do you show that they work in human? Because aging is not a disease. I think you know all of these issues with the regulatory. So it's not very clear what do you do next after you find a drug that works in mice. And we've considered dogs, for example, as a next step. But
yeah, that was also part of my question, like how conserved is aging? We don't know, like, because something which would help extend life in C. elegans, and at Giro, where I previously worked, it was one of the structural analogs of a psychedelic drug, actually extended lifespan in C. elegans. We don't know why, actually, and would it work in humans? Okay, so usurp the microphone and let the audience ask questions.
Thank you for the presentation. One question is the correlation on testing these drugs from one animal to the next. Because, like, right, building off your question of, like, okay, how it affects a mouse, we don't necessarily know how it affects a human. Do you see some things extend the lifespan of a mouse but have no correlation to worms? Do you see something extend the lifespan of a mouse but have a negative effect on worms? Can you talk about that a little bit?
Yeah, so that's exactly the question that we're trying to answer, because that's the key question. I mean, we know we can find drugs in worms, but is it going to be relevant? Is it going to translate to mice? And I mean, right now it's a bit tough to answer. I think definitely we found drugs that extend lifespan both in flies and in worms. And we also starting to have results in mice and fish that basically came from this and are being tested there. But it's a tough question to answer, and you need a lot of data to answer it. So I can't answer it today. And my feeling is it's going to be a bit all over the place. There are some drugs that will be conserved and others not.
How well is aging understood in C. elegans right now? So can you see C. elegans becoming less mobile as it ages, similar to humans? And also, how well is it understood at a cellular level, how they age and die?
Yeah, it's a tough question to answer because I don't know what it means to understand aging. But what I know is, I mean, my philosophy and others is that you don't need to understand it to treat it. So that's the approach that we take. We don't necessarily understand why some drugs work or not, but we know they work. Yeah, I don't know how to answer it. Sorry, if you can be more precise, I can try to answer, but it's tough.
I mean, do we know, for example, some breakdown of some cellular processes in C. elegans which happen after 2 weeks or so, and because like aging for humans are obviously much more complicated and more of a black box, but C. elegans is better understood on a cellular level.
Yeah, so that's also like the very long term question of, what is aging? I mean, for me, aging is an accumulation of damage, so that you're not able to repair more or less. So I think in all the species is like this. Then there are a lot of things that you can see in C. elegans and also in mice and human that may be, more a consequence of aging than a cause. I mean, yeah, it's a very difficult question to answer, but yeah. I mean, yeah, you may know, some people say it's DNA damage, other people say it's epigenetic. I mean, for me, what I say is I don't know, but I think the more okay definition for me would be accumulation of damage that you're not able to sustain or repair.
Hi, I have an additional question to what the person in front of me has asked. Did I understand it correctly that you test a lot of different drugs in basically in worms and then in Drosophila, and only the ones that are effective are going to the fish and mice, or are you testing I don't know different drugs in mice and then like? Are you testing only the effective ones then in the more complex animals? Mm-hmm.
Yeah, exactly. So we try to do like a funnel. So to take advantage of this platform. So yeah, to use worms to pre-select, then flies to pre-select, and only at the end, because it takes longer and more costly, to test only the ones that work in mice. Exactly. Yeah.
Mm-hmm. So isn't there a danger that something is missed that maybe would have worked in mice but has not worked in worms?
Yes, I mean that's also an interesting point because you could, for example, test directly in mice, and you could say I don't need the rest. Mice are more relevant. This I agree. And you could test directly in mice, but the problem is always the cost. And it's true that we may miss something. Another interesting approach is to test directly in mice for biomarkers. That's a bit cheaper than to do lifespan, and there you could be a bit more high throughput. But I mean, experiment in mice also now with the regulation there's a lot of limitation.
Thank you.
Okay, Vladimir.
What's the business model of Epiterna?
Yeah, that's a good question. I didn't mention it. So we've explored a lot of different business models, and because the reality is, in this field, it's tough to have a business model because basically right now, if you find a drug that extends lifespan, the majority of business, like pharma, doesn't care. So yeah, what we've explored is, to treat or prevent age-related diseases in human. Also, so in dogs, there's a company called Loyal that is trying to do lifespan. We've also explored, going more for like natural molecule supplements that you could sell directly without going through the FDA. So we've explored many things, and now we are more on that route to go first with the dogs because it's easier, they have a shorter lifespan, it's also cheaper. I mean, you need less capital initially, so would be to go with dogs, either with a supplement or with the drug, supplement for healthy aging in dogs or a drug to extend lifespan of dogs.
If I would like to have an active substance tested, that's interesting for me. Could you do that for me?
Yes, so this is also a model that we've explored, so more like a CRO to test drugs for lifespan, all those models. And yeah, we are open to that. What I want to mention is there isn't a lot of demand for that. I mean, from what we've seen, it's not that many people that want to test drugs for lifespan. Some companies, a funny thing is also some companies avoid it because there are a lot of aging companies that have drugs in their pipeline that actually don't extend lifespan, and they prefer not to know. So that's also a reality. But yeah, we can offer this service. Yeah.
Okay, guys, thanks a lot for great questions.
Thank you.
Another round of applause. And let me introduce next speaker, Sam Sharifi. He's the head of research at Matter Bioworks.